Good morning. I'm John Woodrich, CEO of Bryan Medical Center. Thank you for attending the press briefing on Tuesday, August 4th. I thought I would start with some numbers, but then address a couple of questions. So our midnight census is 443. We have performed 17,792 tests, 2,095 positives, with just 104 pending. Again, I want to thank our outside lab who's been doing a terrific job turning around our tests, especially in the last 3 weeks. We're getting those turnarounds in actually less than 2 days, which is very good. We have 13 positive COVID patients in-house, 7 from Lancaster County, 6 from outside the county, 3 that are on ventilators. We have 3 people in our intensive care unit, 2 in our progressive care unit, and 8 in our general care unit. So I would like to talk about our current testing. So as we've stated in the past, we have what we call a more rapid test called a Cepheid, which we have a limited supply of those, and we utilize those for inpatients or more severely ill patients. Then we also have a test called Luminex, and that one you can turn around in about 6 to 8 hours. And we reserve that for our healthcare workers and our first responders. And then we utilize an outside lab for all of our other testing. And that's where we have people when they come to our urgent care center or go through our drive-through. So if we would have an outbreak at a school, we would ask people to go ahead and utilize the drive-through or urgent care, or we would work in conjunction with the health department to, if we needed to set up a mobile in order to do more testing, and if we needed to expand our hours for the drive-through, we would do that as well. We would not be able to use that rapid test because we really want to reserve that for the more severely ill individuals. And until that supply gets better, we will utilize the same process as we have before. Right now, we're within a 2-day time period. In fact, on most tests, it's definitely under the 2-day period. But I just want people to think about, as all schools open across the United States, if there happens to be outbreaks, we can see these outside labs getting overwhelmed. So as of today, it's less than 2 days. But I think we would have to see what occurs as these schools begin to open up. We could see quite a demand on these third-party labs that do a lot of the work for us. I believe that test is specifically run for COVID-19, so there isn't anything else being seen when that test is administered. If you recall in the past, when we didn't have access to COVID testing when this first originated in March, we were using a respiratory pathogen panel. And that's a test that looks at a variety of different things, and that's not being utilized at this time. And quite honestly, we prefer not to use that if we haven't been able to identify COVID or back then the influenza. Then we went to that test, and the reason why, that's a very expensive test to run. Whereas something like the COVID test and the influenza is much less expensive for individuals.